Welcome to the Integra LTC Solutions podcast series. This podcast series is a collection of discussions and interviews about our pharmacy technology products and the services helping to position our customers for the best possible outcomes for operational success. Our mission of mindful design and thoughtful service drives us to deliver the best software and technology for your long-term care pharmacy operations to help you deliver the best patient care. The Integra LTC Solutions podcast series is a part of the Pharmacy Podcast Network.
So Kevin Fearon is here, Absolute Pharmacy.
Hey.
Board of Directors.
Really? How you doing?
American Society Consultant Pharmacist, my boss.
It's the first time I've been called his boss.
You and a group of other people, right? And the staff and all the members. I mean, everybody's my boss.
Yeah. Y'all heard of ASCP?
I think they've heard of it. I hope so.
So, what's going on at ASCP?
I don't know. You tell me.
We are
working on our annual meeting for 2018, November, in National Harbor, which is a hometown meeting for us. We're going to have a party where we tour the space, our new space that we're moving into. We have a lot of great speakers. We're going to take advantage of the fact that the FDA, the DEA, CMS is all local, so we're bringing in their top people. That's what we're working on.
So, what are you going to do with this broadcast?
Well, this is the Pharmacy Podcast Network, of which ASCP is a content provider, so we do Senior RX Radio. This particular podcast is sponsored by Integra, so they're collecting interview content that they can use down the road.
Super cool.
Yeah.
Did you get my email?
I don't know. I just have to look. I'm sure I did. So how are you finding this meeting?
You know, I've only been here about 15 minutes, but I like it because it's quaint.
Yeah.
And you can spend time with the vendors because there are only about, 40 of them?
Right. And it seems to be solution-driven, technology-driven, solution-driven, people trying to solve problems with delivery, with technology.
Yeah. It's nice what Integra's done. They've combined some really high intellectual capital with Smith Drugs, Integra, QS1. So it'll be interesting to see how they bring those companies together for synergy.
Yeah. I think what's interesting about that, too, is that it's not just a service provider for a small combo shop pharmacy. It's a service provider that can do the small combo shop, but also the big pharmacies. So gives both of those types of pharmacies a leg up in being more efficient and maximizing reimbursement and making their businesses work.
Yep, I agree.
All right. Any wise words of wisdom from your perch?
Nope. Everybody help us.
All right. Thanks, Kevin. Appreciate it. Thanks for stopping by. All right, I'm standing here with Jeff Schneider, Administrative Vice President, Pharmacy Solutions for Smith Drug Company. Jeff, how are you?
Doing great. How are you doing, Chad?
I'm good. So what are you seeing today?
Seeing all kinds of people looking for all kinds of solutions.
It's good. What do you guys provide?
We provide all kinds of long-term care solutions, from helping startup pharmacies, operating systems, drug distribution, document management, really the whole gamut of solutions.
Okay. You guys are located in
Spartanburg, Valdosta, Paragould, Ohio, and Burlington.
So everywhere. You guys are everywhere. All right. So in your experience looking around at your different clients and seeing what long-term care pharmacies are doing, where are the dollars? Where can they pick up the most dollars contracting with somebody like you that provides some efficient solutions?
I think we help them look at their reimbursement. So I think that's a big piece. Everybody struggles with that. We're fair with our pricing. I think that helps. Drug acquisition is part of the reimbursement and the dollars. I think we can also help people be efficient with the operating systems as well as other document systems that we have as part of our suite of services.
Okay, awesome. Well, thanks for talking to me. Good to see you, Jeff.
Good to see you, Chad.
Looks like it's Jay.
It's working.
All right, we've got Jay Brandley. Jay, tell me about yourself.
Well, I'm with SDS Rx.
Okay.
We are the premier delivery company.
And you're a platinum sponsor.
We are the platinum sponsor.
The platinum sponsor.
Yes.
Thank you.
Pleasure to be here.
All right. What do you see?
I see a lot of folks interested in what we're all interested in, right? So this is the world we live in, and we want to do what we can to help folks get their product out to the patients.
Okay. So what does SDS Rx do?
Well, so SDS Rx really is a delivery company. We specialize in two facets of the business.
Okay.
Mostly it's pharmacy to patient or facility,
Okay.
and it's also from wholesaler into pharmacy.
Okay.
But bread and butter business that we do here with, now 72 pharmacies. Probably after July, it'll be 80 pharmacies in 23 states.
That's
going
awesome.
from pharmacy again to individual or facility.
So we've talked to a lot of people today. What do you think the major threats are, or where do you see this industry going?
Well, right now for us, I see a threat, the Amazon effect, which some of the folks are going to talk about.
We're going to talk about that this week.
We've got a very strong economy, so in what we do, we're always looking for great people, the challenge to find good people
Sure.
that all these pharmacies see, which eventually causes them, in many cases, to outsource to a company like us to do the deliveries, get rid of the headache, the liability,
Sure.
and the challenge of recruiting.
Right. And I think that's a theme here is if you talk to a lot of the vendors here, they're all about bringing an efficiency to the pharmacy. So how can a service, an outsourced service, be hand in glove with a service-oriented pharmacy? And that's hard to do. But it sounds like it's what you guys do.
It
You
is hard to
specialize in
do.
it.
And of course, if you look at most pharmacies, you'll say 70% of them are still insourced. They haven't chosen to make
Absolutely.
that leap. But the ones that have, the driver who today is our driver, tomorrow he delivers for you, and he's your driver.
Right.
And he represents you, and he will see your customers a lot more than you will because he's delivering to them every day.
Right.
So we feel that we do work hand in glove, to use your words.
Yeah.
And they're an extension of you, of your brand.
Right. In my former life, before taking this role with ASCP, I had a consulting company, and it was the same kind of sale. It was, do you want to give us your consultant pharmacists? They're the face of your organization in some cases, as is the delivery driver.
Right.
And there has to be a comfort level with that. Because
Absolutely.
that's the person that the end client is going to see on a daily basis, or in our case,
Right.
a couple days a month.
Right.
And it has to feel like that pharmacy.
Absolutely.
So,
and to that end, we'll put our driver in uniform. We'll co-brand with your logo. We'll put our driver in your uniform, if you like.
Right.
So he looks and feels again like your driver.
That's awesome. What else can you say about this industry?
Boy.
You see consolidation. You see the growth of independence. You see, what do you see?
Well, you talk about the independents. You look in our world again. It's a smaller sale versus the big,
Sure.
giant companies that are out there. But they're the companies that are really driving this business forward in innovation, in mostly customer service. They're a lot closer to their client, I think, than the bigger folks that are out there.
I think that's fair. So I think it's a good point. So they're the ones that drive the change that eventually becomes the bigger player.
Exactly right.
Right. Well, Jay, I appreciate coming by.
Well, it's been my pleasure.
Thank you for being the Platinum sponsor.
Oh, our pleasure. Thank
All
you
right.
for having us.
Thanks.
Thank
Appreciate
you.
it. So, how are you?
Excellent. How about yourself?
I'm good. Tell me your name.
I'm Carmen Foster.
And you work at?
I am with M-Chest Pharmacy Plano.
Okay.
Yes.
Medicine Chest?
Yes.
Plano?
Yes.
Very good. How many beds do you service out of that
We are
location?
at 3,700 beds currently.
Okay. And how many Medicine Chest total?
4.
Huh?
4.
4 pharmacies, but how many beds total?
About 19,000
That's
between
huge.
the 4 of us.
That's
Yes.
awesome.
And so our location actually just opened in December,
Okay.
and we've gone from 0 beds to 3,700 beds today.
That's today?
Yes.
Just right now?
Yes.
Oh, you should be drinking. There
Yeah,
it is.
I am.
Very
I
good.
actually
That's
am,
awesome.
In fact, yes.
That's exciting.
Yes, it is. It's been quite an aggressive growth for us, but we are very excited.
So what's the plan?
We're just going to keep growing and
But I
keep
mean,
taking
you
care
just
of
started
patients.
3,700 beds today, or you're
Oh, no.
planning to start them?
Oh no, we have been rolling them out since December 1st.
Okay, so you got the 3,700
We started
today.
with 0, and
Okay.
then we took on 300, and then 600, and so on and so forth.
Okay,
until
so
today.
from the perspective of the people in the room, what kind of support did you need to be able to pull that off?
Well, of course, there's your support in the pharmacy, your staff. obviously. So you have to have a very good team of technicians and pharmacists that can support you through that.
Absolutely.
But also, technology is very important too. So you rely on your technology to help you make things easier and to kind of consolidate your work, essentially. And so, that's why things like this conference are so important, because you can really get face-to-face with the vendors and talk to them about what their offerings are.
That's true. It's awesome. ASCP's meeting this year is in November, and it's in D.C., but next year it's in Dallas.
Yes.
So it's going to be in your backyard.
I am aware.
And there's a number of pharmacies that emanate out of Dallas. Like, I think there's a number of everything that emanates out of Dallas.
So, you know what? Every time, as we are growing, I'm interviewing staff like crazy, because we're constantly adding on. And that is one of my really big talking points when I interview folks. We have about 20 long-term care pharmacies in our backyard, literally in Dallas. I mean, you can throw a rock and you can hit a long-term care pharmacy. And so for us, it's very important that we have a really good environment and a really good team so that folks want to come and work for us. But yeah, I mean, Dallas, Texas is a very hot area right now for
So why do you
long-term
think
care.
that is? Let's talk about that, because I had an earlier conversation and the gentleman said that he sees sort of a barren area for the next 5 or 10 years of long-term care beds and opportunity. And I don't know that I agree 100% with that. I think every day we have more people entering an age range that is going to require long-term care services of some kind.
Absolutely.
So is your growth primarily in SNF business? Is it AL and SNF?
It's both. So we have experienced growth in both. We've been fortunate. I know that that's not the case for everybody. SNF growth has kind of maybe tapered off quite a bit. We've actually still been able to still grow in that area. But I will tell you that in Dallas, we're seeing memory care and ALF, facilities pop up everywhere.
Yeah, and I think that's what we're seeing across the country, is that people are wanting that next level of care.
Absolutely.
They don't quite need IVs and need to be doing rehab for 2 weeks and going home, but they need a place that they're going to go, and almost that old rest home style.
Yes.
Which is the assisted living and the memory care.
Yes, absolutely.
So yeah, I talk a lot about that we don't make new nursing home beds.
Right.
For the last 20 years, we haven't made any new nursing home beds, but the population has started to go like this, which turns the nursing home beds that you have into rehabilitation beds, advanced dementia beds, advanced psych beds, because those groups have nowhere to go but the SNF.
Yes.
But then it also pushes everybody else back down into that AL environment, and now you're seeing, whereas AL used to be almost like an apartment complex for older people. Now it's becoming memory care. Now they're a little bit more sophisticated, need a little bit more hand-holding and help.
Yes.
And it just kind of pushes from there.
Yes.
So it's interesting.
And so I think that now is maybe the most opportune time for long-term care pharmacists like ourselves to really get, our hands on those patients and show folks what we can do clinically. And really, take care of our most frail and elderly patients.
I'm happy to hear you say that. I took the role at ASCP for that reason, because I look around and all I see is opportunity for pharmacists.
Absolutely.
I mean, the healthcare system is a financial disaster. Mm-hmm. The people that we take care of consume a third of the medications in the country.
Yep.
They happen to be growing at an unprecedented rate.
Yes.
And we need a pharmacist involved in that picture to help manage that.
Yes.
Not just from a clinical standpoint, but from a packaging standpoint, from an assessment standpoint.
Yes.
And then from that clinical standpoint.
Absolutely.
So I think it's a golden age to be a pharmacist. I think it's a tremendous opportunity.
So I agree with you. Medication adherence plays a really big part in that. And then there's, recently, one of my pet projects has been medication therapy management.
Right.
Because I recently came to the realization that 88% of the CMS dollars that are available for medication therapy management are still left on the table.
They're on the table.
88% of those cases are still left on the table. And so that is such a great opportunity for us as pharmacists.
It is.
To take advantage.
And it's a system that's been built for an ambulatory environment.
Yes.
So you call somebody on the phone and you do an MTM on the phone because they're living at home, and
Yes.
you're contacted maybe by the pharmacy, the corner drugstore that filled your script. But in long-term care, we don't have that mechanism.
Yes.
So you've got to be able to do it in a different way.
Yes.
And
Absolutely.
everybody in long-term care of that age range more than qualifies for MTM. So we're not worried about,
Oh, no.
hey, do you, according to your insurance plan, do you qualify for this? Everybody in long-term care, I would have to think, qualifies for MTM
Oh,
for the
absolutely,
insurance
at
company
some
they
point
have.
or
So,
another. And
right.
then our consultant pharmacists are in those buildings essentially doing MTM. And so it's a great way for them to, for them to do both and really kind of flex their clinical muscles at the same time and take care of our patients.
Well, that's awesome.
Yeah.
Well, I appreciate you stopping by.
Well, thanks for having
Thanks for
me.
being here. Absolutely. All right. Carmen from Medics and Chest, Plano.
Yes,
Thanks
thank
for
you
being
so
here.
much.
All right.
Have a good show.
Thank you.
Thank you for listening to the Integra LTC Solutions podcast series, part of the Pharmacy Podcast Network. Integra designs, develops, and supports long-term care pharmacy software solutions for the LTC pharmacy market. Focused on meeting customer needs, our mission of mindful design and thoughtful service drives us to create the most functional, intuitive products on the market. Contact us today to talk about your long-term care pharmacy's operations. Find us on the web at integragroup.com.